Dr. Sophia Yan with Pandia Health, and today we're going to talk about the birth control pill. What is it? How do you use it? And what are the pros and cons? So what is a birth control pill? When we talk about the pill, we generally mean the combination pill, which has both estrogen and progesterone. And you have to take a pill every single day in order to use this medication. And there are usually 3 weeks of active pills and then 1 week of sugar pills. And during that 1 week of sugar pills is when you will have your withdrawal bleed if you choose to have a withdrawal bleed. The pros of the birth control pill are that it is a method that you can use to skip your periods. And the way you skip your periods is you just skip that sugar week, and you can choose how often you want to have your period. It could be every 3 months, it could be every 6 months, or it could be never, just depending how often you want to insert that sugar pill week in your life. The cons of the birth control pill are that you have to remember to take something every single day, and ideally at the same time. Though with the combined pills, it's kind of forgiving in that it can be plus or minus 3 hours. With the progesterone-only pill, you have to take it at the same time every day, and if you're 3 hours late, you actually need to abstain from sex or use some emergency contraception. But with the combined pill, it's a little more forgiving. The other con of the birth control pill is the same as the birth control patch or ring, which is some people experience a little nausea. And in order to avoid that with the pill, we suggest that you take the pill with your largest meal of the day. If after a week you've tried doing that and that doesn't work for you, then you may want to move it right before you go to bed. In my 10 years of prescribing birth control, I've only had 2 women wake up in the middle of the night with nauseous dreams. So most women do fine. Just take it right before you go to bed. The other thing that can happen with the birth control pill is that some women notice some acne. There are 40 different birth control pills out there. So if you notice acne on one pill, first give it a month or 2 just to let things settle out and see if it works well for you. And if after 2 months you still have acne on this pill, there's 39 other pills that you can try. So talk to your provider about considering that. And then lastly, women can get the munchies. And it's not specific to the pill. It also happens with the patch or the ring or other methods that have progesterone in it. And it's all how you deal with the munchies. If you can deal with the munchies by exercising a little more, eating a little more healthy, eating celery and chewing sugar-free gum, that might be helpful. But if you notice that when you have munchies, you're reaching for fast food, candy, chips, and cakes, then you might have a little issue with the munchies. But again, there's 40 different birth control pills, and you can try a different one, and different ones, women respond differently. Each woman is different. So don't give up, and give everything about 2 to 3 months try before you give up, and definitely discuss things with your provider. Thank you for watching Birth Control Questions with Pandia Health. And if you have any questions, feel free to put them in the comments. Check out pandiahealth.com if you want your birth control delivered. Skip the trip to the pharmacy every single month. And then like us, subscribe to us, and tell your friends. Thanks.